are going to look at it. Yes, name and history is the first. Yes, very right, Zen. The ECG name and the history of your patient is very much important, because if you don't know the history, you are not going to tell what you are going to see, what you are going to look for. It is like going in a haystack and finding for a needle. So first you are going to check for the name, if anywhere written, or check for the history of the patient, what is the history of patient, and after that you are going to check for the calibration. The calibration is usually given on the lower side and of an ECG, like this one. You can clearly see 25 and the 10. It is clearly seen, and this is a normal kind of ECG. So for learning the ECG, there are two kind of things. Most of people find difficult learning the ECG because there are many facts to remember. A fact is a number. It is a number to remember or to brand. So that's why most of the students find it very difficult. So there are two things: number and the concept. Concept is very easy. Like someone get a lacerated wound, what is going to happen? There is going to be inflammation. There is going to be bleeding. There are going to be a neutrophil. This is the concept. So it is very easy to remember. In ECG, there are few facts you need to remember. So just a second for the Azan, and then we will continue. So let's continue. So I was telling you about the fact. So you are going to remember the fact, and fact is difficult to get remembered. So these 25 and 10 is the normal speed and calibration, and the voltage. So speed is what? Speed is basically the speed on which paper is going to be moving. All right. So 25 millimeter is the speed on which paper is moving, and that is recording your heart rate. All right, very simple to remember. Now, if the paper is moving on the faster rate, what is going to happen? Your heart rate is going to be a slower. If paper is moving slower, then your heart rate is going to be fast on the paper. So this is the normal. That's why looking at that 25 number is important. 25 is important. All right. It's just like a wall is moving and I am throwing a ball on it on a constant speed. If wall is going moving very fast, then my ball speed is going to be slower. I'm going to uh, like hit the wall, throw the ball on the same speed. But if the ball is moving slower, my ball, the ball I am throwing is going to be more on the wall. So that's why this 25 is the standard. This is the normal calibration. After the name and the history, this 25 and 10 is important to remember. And the 10 is going to be a voltage. Voltage is what? This is the normal value of this QRS complex, or the P wave that are going to be amplitude. amplitude are shown in on a paper. So this 10 millivolt is the constant. All right. So after that, as you all said, we are going to see for the rate, rhythm, and the axis. Very rightly said. After that, this is the standard practice. If you go beyond the advanced level, if you are an expert like electrophysiologist or cardiologist, you don't need to follow these two steps, because there is going to be a visual memory inside you, and you are going to remember, you are going to see for the fact for all these things. So Neha asked, "What is the voltage?" Voltage is nothing but basically a constant number that is going to show you this QRS complex. If voltage is more than 10, the QRS complex is going to be smaller. All right, or the P wave is going to be smaller. If voltage is going to be uh, lower, then QRS is going to be big or huge on the ECG paper, and that can represent an abnormality. All right. So this is okay. And now let's come to the rate. How you are going to calculate the rate? Okay, let me move to the next slide. Okay, but before that, coming to the rate, let's discuss what are these waves. Basically, you have all read in your MBBS that P wave is going to be shown as atrial depolarization, which is shown by the P wave, and then there is QRS complex that is going to be shown as the ventricular depolarization. All right, and then there is T wave, which is going to show the relaxation of the ventricle or repolarization of the ventricle. All right, but anyone can tell me where is the repolarization of the atria? Where is the repolarization of the atria? These are the normal complexes P, Q, R, S, and T wave. Why I can't see the repolarization of the atria? Yes, Taha is very right. It is masked by the ventricular depolarization. The simple concept of that is the ventricular have larger masses. It is bigger in size as compared to atria. Atria is smaller, ventricular are big. That's why it get embedded in the QRS complex. Okay, there are few segments, although the ST segment is very much important. If it is goes down, if it goes up, it is going to show an MI. Most of the time, there are also conditions like pericarditis which can increase our early repolarization, and the PR interval is important. PR interval is going to show you regarding the blocks. The PR interval here, it is not correctly shown. PR interval start with the start of the P wave and the start of the Q waves. All right. So the start of the P wave and the start of Q wave generally show the PR interval, and it is normally between 200 milliseconds. So, as I was telling you about the fact you need to remember is the normal calibration 25 and 10. And another fact you are going to remember is the normal PR interval that is going to be at 200 milliseconds. So, the one small box, let me just clear that thing. So, the one small box, like this small box, as you all can see. So the one large box contain the five small box. So one small box is going to be equal to 1 millivolt. All right, 1 millivolt is equal to 40 milliseconds. All right. Uh, if you are going to remember in seconds, this is going to be zero point 0.2 seconds. These are the general fact you need to remember to get your things across the ECG. All right, facts are difficult to remember. That's why you need to write them down, and you can repeatedly see them. You can paste on wall, or you can paste on your door, and whenever you are coming or going, you can see that, and that would be easy for you to remember. So normal fact, calibration is a fact. You need to remember normal one small box is equal to 1 millivolt, or it is going to be equal to 40 milliseconds. Milliseconds are easy to remember because they are a normal number. There is no decimal like in second 0.2. So one small box is equal to 40 millisecond. Wherever the large box is going to be equal to 200 milliseconds, because the five small boxes compare can give you a large box. That's why it is going to be 200 milliseconds. All right. So moving forward. Okay, so the normal P wave is because of the depolarization of the atria at the SA node, because SA node is a specialized cell which goes into the depolarization and it is going to contract the atria. All right. So the normal P wave is going to show you regarding it is sinus rhythm. Okay. So can anyone tell me heart rate can be irregular even after having a sinus rhythm? Sinus rhythm, the rhythm is nothing but it is SA node generating the P wave, SA node generating the contraction of the atria and all these things that is shown by the P wave. And my question is, again I'm repeating, can you have an irregular heart rate with sinus rhythm? You can have sinus tachycardia, but sinus tachycardia is going to have a regular rhythm. All right. When you are in an exam, you are giving a viva to a very difficult exam. Your heart rate is going to be raised. That is sinus tachycardia, but that is going to be a regular. Abdul Wase have raised the hand. You can write the answer, and I can. Or you want to answer from the mic? Sinus arrhythmia. Yes, we can have sinus arrhythmia. Generally, the answer is yes. You can have a sinus rhythm, but you can have an irregular rhythm. Sinus arrhythmia is answer to that. Even the complete heart block, you have a sinus rhythm. P wave is firing, but the ventricle is firing on its own. So you can have a irregular rhythm like that. So moving forward, then we are going to we have discussed about the QRS complex. Then we are going to discuss about the T wave. T wave is basically the repolarization of the ventricle, and certain electrolyte imbalances can have effect on the T wave. All right, like hyperkalemia can have a large or tall tented T waves, or hypokalemia can have a flat T wave. There is U wave associated with that also. But this is for you. Just remember, electrolyte imbalances can have change on the T wave. All right, this is and basically again all these same things. Now here it is rightly written the PR interval is going to start at the P wave and end in the starting of the Q wave. Now this is given in the second. That is difficult to remember. For you, it is going to be 200 millisecond. So that is easy to remember. All right. So the P wave and then is QRS complexes. QRS complexes is going to be less than 0.12 millisecond. All right. Normally this is narrow complex. Normal this is less than 0.12 seconds. Then there is the ST segment, very important. It is start from the end of the S wave and start of the T wave. All right. This segment is going to